so that others who weren't able to attend today will be able to see this in the future. So I just wanted to be sure to point that out. Alrighty, so a brief history about UK and STEPS. As many of you know, the University of Kentucky has been around since 1865. We are the University of Kentucky, and we're actually one of the largest employers in the region. No surprise to anyone there. So throughout your career, you have made a difference in the lives of Kentuckians. Post-retirement temporary positions give you the opportunity to continue doing meaningful work as well as staying engaged with the University of Kentucky. We talk to retirees several times a week that, who have retired or considering retirement, who just want to come back, whether it's on a bigger scale or a smaller scale, but just being a part of the university, they really loved what they've done, and the university has really become a part of who they are. So it's a great work, and great place to continue working and seek that meaningfulness. So the STEPS office is UK's internal temporary staffing department and has staffed temporary positions of all kinds across campus in UK healthcare for over 40 years. We're hitting close to 50 years. We've been around since 1978. Just a little history for those who do not know about STEPS and how long we've been here. And I also want to mention that post-retirement, there are two ways, and why I should say this information is important. There are two ways to return to work after your retirement. One is through a board of trustees post-retirement appointment, and the other is through STEPS temporary employment. And so that's why I mentioned that we're not going anywhere anytime soon here. And so you could definitely find out more online if you want to visit our HR webpage about the two different ways to come back as an employee through the university, as a STEPS employee, I should say, or a temporary employee at the University of Kentucky post-retirement. But the first step that I mentioned there, a post-retirement appointment, this may be used in limited cases. For instance, when it is essential to a university program or office, or when it is otherwise impossible, practically, to fill a position with a fully qualified person. So in that case, that's usually when that can be filled, such as a part-time or full-time appointment that is restricted to a former staff employees, or I should say it is restricted to former staff employees who have been elected to retire and require specific prior approval to the Board of Trustees. And I do want to mention that it is usually made for a period to not exceed 1 year. Let's see here. A retiree may be employed as a temporary employee to perform duties for which fee schedules have been established and approved by the provost or the executive vice president for finance and administration. So, of course, the second option there, which is what we're here to talk about, is through STEPS. And I want to mention again that STEPS is a part of the University of Kentucky employment team. A lot of people do not know that. And so we like to spread that knowledge that STEPS is a part of the University of Kentucky employment team. We're not a different entity or agency or anything like that. Just
Hey, Nicole.
FYI. Sure.
Sorry. You're still on the University of Kentucky first page. It
Oh,
doesn't look like it's progressing on our
thank,
side. Just a heads
thank you,
up.
Kirsten. Thank you so much. Thank you so much. Let's see here. There we go. Thank you, Kirsten. Thank you for chiming in there. All righty. Okay, so thank you. So yeah, STEPS employment, once again, we have been here for quite some time, and STEPS employment, like you said, it's not limited. A lot of people think that, when we see that STEPS there because it's student, it's initially known for student placement when we originated, but we are not limited to that by far. What we do is we help to staff positions on the academia side of our campus in healthcare to help support student services as well as healthcare services. So we definitely want to point that out. All righty, so let's see here. What do we have next? So STEPS employment, sorry about that. Let me move this chat box out of the way here, you guys. So STEPS employment overall can be a wonderful, wonderful place, of course, as I mentioned already, to continue your career here at UK. STEPS provides a wonderful way for you to remain engaged with the University of Kentucky. If you work for the first year, let's see here, sorry about that. If you work for the first year of your retirement, your plan costs will remain the same as prior to your retirement. And of course, if something has changed with that, we'll definitely have Terry explain a little more about that in later in the presentation. But this is not dependent on the number of hours you work. If you work past your first year of retirement, your healthcare plan costs can change depending on the number of hours worked or level of coverage. We have a wonderful retirement officer that I'm talking about now, Ms. Terry Knatzer, in Human Resources, as well as a few other members of her team that can assist you with questions about healthcare plan costs. I do want to mention, however, that averaging at least 8 hours of work per week can reduce your healthcare costs if hired prior to January 1st, 2006, and retiring within 15 or more years of regular continuous service. So definitely don't want to fail to mention those things there. Alrighty, and once again, if you have questions, like we have a few of them, be sure to put those in the chat and Kirsten will try to answer those for you. Alrighty, so this is a big one here. So tips for a successful transition. Alrighty, so of course we want to talk, as the bullet points mentioned here, talk with your retirement officer to understand how working post-retirement would affect you. It does differ for each person. Of course, there's the general, the general bullet points and things that happen there, but each person's situation is unique. So it would be best practice to speak with a retirement officer. Let's see here. As mentioned, there are many variables to consider, such as your age of retirement, how many hours you would like to work, what your level of coverage will be, etc. Let's see here, of course, talking with your manager or department administrator to determine their need if you desire to return to your current department. And that one is, that is a common question, I believe, that we get, especially here in our STEPS office, Kirsten and I and some of our other coworkers, whether or not someone actually has to stay in their department. And the answer to that is no. It does seem, it is the most popular way, I should say, for post-retirees to come by, the most popular selection, I should say, because they usually talk with their supervisors and managers, and many of the positions are pre-approved before that retirement action is even taken, that retirement date has come, I should say. So you do not have to wait until you actually retire and then come back to steps or through steps. Although that is an option, you do not have to wait. You can get the ball rolling before then. And speaking with your supervisors or managers also, and especially in healthcare, not limiting campus, but especially in healthcare, many of the positions do need to be pre-approved. And so it is ideal to speak with your supervisor or manager so that they can go through all the necessary channels to get that position approved for you. Alrighty, so when speaking with your supervisor or your manager, it's definitely ideal to remember to discuss expectations on the rate of pay, your work schedule, etc. This can differ, and so that is something that you would definitely want to be aware of before going into your steps role. Alrighty, let's see here. Let's go ahead and talk about things to consider. Okay, so things to consider while thinking about going into a steps position. One of the big ones is that knowing that all steps positions have hourly pay rates. And so you want to be mindful, especially those who may, currently, who I should say are currently paid monthly. You want to be aware of those dates, start and end dates, and how they will affect you. And this is another reason, when bringing up the point that each separation or each retirement, for each person, each employee, I should say, why it is unique. Because start dates are unique, things like that, and as mentioned, age, etc. But this is a really big one here. Start dates and end dates do affect when you can and cannot start in a role post-retirement through steps. One example, of course, would be monthly employees tend to begin, or at the beginning of a month, versus someone who is already biweekly could start within a couple of weeks. And of course, that is after, I don't want to fail to mention, after a gap in employment. So you could not start in your position if it is approved, you could not start in that position until you've been separated from the university for at least one full day. So one 24-hour cycle. So that's whether you're a monthly or a biweekly or exempt or non-exempt monthly or biweekly paid employee. So yes, once again, all STEPS positions are hourly, regardless of the type of work or pay rate. STEPS employees are only paid for time worked. So TDL, vacation accrual, and other types of paid leave are not available for STEPS employees. However, that does not limit you to taking time off and things like that. That's something that you would discuss with your supervisor or your manager. For the retirement process, there must be one calendar day, as I've already mentioned to you, of separation between retirement and returning to work. This can be a weekend day, just FYI, it doesn't have to be a weekday. Some new hire paperwork may be needed, but not for all employees, but for some employees. If you started prior to the fall of 1984, an I-9 may be needed. We found that some of the employees have not completed I-9s. Not many, but some have not completed I-9s. And for those who are in healthcare, a new background check will be needed if you have not had a background check within one calendar year. So just FYI. It comes to as a surprise to some of our rehires who are in post-retirement, but a background check and drug screen may also be needed if it's older than 1 year. Let's see here. And of course, we've already talked about monthly paid employees being sure to discuss their separation dates with workforce management supervisors and retirement officers. Okay, so let's see here. Let's talk a little bit more about STEPS temporary employment here. All righty. So, and for those who may have joined us a little late here, we just want to point out again that STEPS has been around for over 40 years. And once again, we're hitting close to 50 here. But the STEPS team hires over 1,000 employees each year. Of course, a lot of people don't know that much about STEPS, but you can also find more about us on the HR homepage and just click on employment and you'll see a little tab there about temporary employment. You can find out more about STEPS. But yes, we hire over 1,000 employees each year and have employees in more than 330 different departments across campus and throughout healthcare. And we're pretty busy here in our office. Of course, not just hiring for positions for retirees, but for regular staff, part-time staff also. And so I do want to mention that we don't just hire for full-time temp positions, but sometimes there is an opportunity for part-time as well. Our employers work in just about any job title or role you can imagine. Some examples are patient schedulers, HVAC technicians, clergy members, warehouse workers, pharmacy techs, golf cart mechanics, anything that you could think of, we probably have assisted with hiring for. We hire for, once again, a variety of shifts across both campus and healthcare. So just keep that in mind. We are not limited. Piano players, I'm trying to think of some unique positions that horticulture, things like that, just anything that you could think of. Research, we hire for a lot of research positions also. Let's see here. We can go on to our next slide here. Okay, once again, as I mentioned, some frequently filled positions. Let's see here. Healthcare positions are usually in high demand. And I don't want to fail to mention that we hire so many people that we actually have two teams here. We have a team that staffs just for healthcare and a team that assists for campus, the academic, on the academic side. Myself and my coworker Kirsten, who is here helping in the chat today, we both help to support campus, and Roxanne Ruth and Alex Halbert, our other coworkers, help to support UK healthcare. And one fun fact is that all of us at some point have supported UK healthcare. So that lets you know how much of a demand it is for UK healthcare. But healthcare positions are usually in high demand, such as obviously registered nurses, patient registration staff, and other licensed healthcare professionals like medical assistants. And as I mentioned before, pharmacy techs, etc., radiology, anything that you can think of, we've helped to staff for. There's also a high demand for UK positions such as business officer roles with experience in payroll duties, SAP, Concur, and Epic. One of the really good reasons or highlights there with bringing retirees back into positions, because retirees tend to have this experience that we're already looking for. So just a little nugget there. Many of the UK healthcare positions filled are in clinical or ambulatory areas in UK healthcare. So don't want to fail to mention that. UK Healthcare Steps also offer pipeline programs for careers in pharmacy, nursing assistants, and sterilization techs. This is actually growing as we work with our administration team. So anyone looking for a second career or know someone, that is a great way to start with in some of our pipeline programs here. Okay, some frequently filled positions. We'll just continuing on there, more so on the campus side. A lot of staff support, administrative type of positions, IT, financial affairs, etc. Okay, and so we definitely want to talk about UK retired employee parking. So the University of Kentucky retirees are eligible for a reduced parking rate here on campus. Individuals with an e-retiree permit may park in any intermediate E-lot, K-lot, or EK area. This information is also available online, and you can contact the Transportation Services Department or visit one of their locations to speak more about or to obtain a new tag if that's needed. Okay, so I am going to pass on the torch here to Miss Terry Knaxer to speak a little more with you all about your insurance rates.
Okie dokie.
Mhm.
Thank you, Nicole. So, as
Welcome.
Nicole mentioned earlier, once you retire from UK, you're only eligible for STEPS employment, so temporary positions, or it's a post-retirement appointment. And we see, I would say, probably 90% of the post-retirement appointments, these are faculty positions through the colleges across campus
Hey, girl.
that have
Hello.
to, can you hear me? Okay, I'm not sure what that was about. Anyway, but they are temporary positions and anyway, through steps or post-retirement. If you're working 20% or more FTE, you return to work no later than 3 months after you retire. You're eligible to remain in your current Anthem insurance plan. That's the UK HMO PPO plan, and will pay the same rate. And this has to do with the Affordable Care Act, 1 year stability period. This is something we can discuss with you in a retirement meeting if we know that STEPS is on the table soon after you retire. And that includes your dependents. For that 1 year stability, dependents would also receive the same rates you're paying now. With that said, if it's 3 months post your retirement date that you're rehired through STEPS, it's a reduced rate for working retirees and dependents. And I'm going to share that on the next slide here in just a second. It's a little higher premium if you have dependents on your plan, but if it's just single plan, it would be the same cost. If you are 65 or older and you return to STEPS, your employer sponsored plan, so that's Anthem, HMO, PPO plan, is primary over Medicare, and you can delay the filing of your Part B with Social Security until your steps ends or your assignment FTE is less than 20%. And if you don't mind, advance that slide for me, Nicole.
Mhm.
Okay.
There it goes. Mhm.
All right. And so if this chart here is going to give you a range, and one of the things that we're looking at for what we can charge you for the health insurance is if you were hired after 2006 or before. So if you were hired after 2006 and you're retiring without the health credit, it's going to be a higher premium than if you were hired before 2006. And so this chart here reflects if you were hired after 3 months from your retirement date, or if you're getting that stability rate for 12 months, then you're getting, at the end of that stability period, you would have a higher premium for your insurance. So let's talk about this cost range. If you were hired after 2006, kind of a teal green color code there, that $799 would be for a single plan. And the very high cost end of that, 2,277, is if you're covering a family. Let's look at the other side of the spectrum. If you were hired before 2006, you're retiring with the health subsidy. A single plan for the HMO would be $55 a month or $99 a month if it's the PPO. But at that higher cost end, at that point, your dependents are not eligible for a subsidy, only the employee subsidy. And that 1,533 rate is factoring in family coverage. So this can change every year. We always keep an updated working retiree premium chart on our benefits website that you can look at. But I think more importantly than that, talk to the retirement specialist you're working with. There are 3 of us in the benefits office that work with retiring employees. We cover all this when we have meetings with you. This contact page would be good to reference. I'm one of the retirement specialists, but also there's Kim Cook and Coleman Simpson. And the best way to connect with us for a benefits meeting, if you've not worked with one of us individually in the past, is by just emailing retirement@uky.edu. We share this email. We could schedule a benefits meeting, and if STEPS is something that's on the table, we'll definitely talk to you about your timing, the timing considerations, and how this would change with your health insurance cost. Some other resources is just knowing our main benefits customer service line, because sometimes we're in meetings often throughout the day and we can be hard to get. We always try to return phone calls or emails within 24 hours, but if it's something you want an answer on quickly, call our main benefits customer service line, because oftentimes just general questions they can answer. And Keeley Nays is a good contact in the benefits office, because once you've retired, all the billing, any changes in your bank account, or with plans would be all handled through Keeley. And we always like to make sure Debbie Martin, her information's out there, because she's our benefits advocate. Every once in a blue moon, someone will retire and have a claim issue due to the change in status or timing. And Debbie is stepping in just to help facilitate matters if there is an issue. But I would say 99% of the time, there are no issues that people have during transitional periods changing from insurance plans. That's all I have. There might be some questions in the chat, but I'll be sure to answer them, and I will pass the torch back to you, Nicole.
Thank you. Thank you, Terry. Terry brings up some really good points here, and as a wealth of knowledge, once again, about that transition, or even if you're thinking about transitioning to STEPS, we work very close with one another, and some of the questions that I cannot answer, we would reference to the retirement officers. Well, let's see here. There are a few questions in the chat, and we'll be sure to get to those. Alrighty. So, if you are planning to return to work outside of your current department, you would like to speak to one of our STEPS members here, you can feel free to, I should say, to contact two of our employment consultants that are listed here, or I should say, our only two employment consultants listed here. For UK Healthcare, we have Roxanne Ruth, and you can reach Roxanne at 859-257-2993. And of course, our email is listed here. You can also find our consultants, and of course, Kirsten McKinney, once again, who was in the chat with us now. Either one of the consultants here, you'll be able to find them in the address book. And once again, on our HR homepage, if you click on temporary employment, on employment, and then temporary employment, you could find any contact information that you are looking for. And in addition, if you're not able to reach one of the consultants here, there are two specialists here in the office, myself, Nicole, and as well as our other specialist, Alex Talbert. And we also have our admin, Tatum, who is available if you call the office and can't reach one of us. Tatum will be sure to take a message for you or point you in the right direction. Alrighty, let's see here. Okay, so I just want to say once again that the University of Kentucky is increasingly the first choice of staff to pursue their passions and their professional goals during your career at the University of Kentucky. We've been recognized from many areas, including Forbes, Insight. UK has also been ranked several times as one of the best colleges to work for, the Chronicle of Higher Education. And our patients know and appreciate the fact that UK Healthcare has been named the state's top hospital. So not only are we a great college, but once again, we are known for our great care here at the University of Kentucky. Alrighty, so that is just about it for our presentation today. And let's see here. If you have not got your questions answered, okay, it looks like we have a link shared there. Great. And I'm going to go ahead and place my email here in the chat as well if you have questions. Let's see here. And once again, one of the best ways, even if you're considering, I can't reiterate this enough, is doing your research. Yes, there will be a link sent out. Sorry, I'm reading something live here from the chat. This is being recorded and will be sent out. We know that many people could not join us here during their lunch hours, or their lunch hours may be later, or you may have joined a little later and missed some of the information that was shared on the previous slides. So we don't want you to miss anything, and we will have this shared and uploaded for you all. But once again, STEPS is a great way to continue employment. And once again, if you don't have an interest in being in your current department, and there's a department that you've always been curious about working in, this is a great platform to be able to be able to get into that other field, or I shouldn't say volunteer work, because state STEPS is a paid positions, but just something that you may have been interested in doing. Some examples would be someone that's been nursing. I've heard that before, that nurses are like, yeah, I really don't want to do bedside anymore. Is there something else that I can do? And they'll take on another role. Things like that, just a few examples. So don't be shy with looking. That's also a point that I would like to make, is that you can look online. If you're not sure about what you want to do and you're like, no, I want to retire now and maybe I'll come back later. That is also another way to come back, is to just do some self research and observation just on the UK web. Just look on the website and apply for some positions, but knowing that, and meeting, I should say, and knowing that you still may have some limitations. So you still want to meet and discuss with the retirement officers about hours or limits or things like that. But you can also seek employment and look on our websites to kind of see what's out there. Alrighty, let's see here. Terry, do you have anything else that you would like to share?
I think we've answered most everything in the chat. I know there were some concerns about the Medicare Advantage plan and just noting about the filing, I think for Medicare and going on that if you are working steps. And that's something where we work very closely with the staff's office because we need to look at your health insurance. We need to see what your FTE is before we can answer or clarify what that would be for you if you're 65 or older. But I can tell you 100%, if you're working steps 20% FTE, you cannot be on the Medicare Advantage plan. Anthem has to be primary. And we're looking after you. We're making sure that you're enrolled in the right plans because we do not want you to have claim issues later. So we're very proactive in reaching out to those folks if you are working more hours and you need to switch back to Anthem. So just keep in contact with the person you're working with prior to retirement so we can make sure everything gets sets up correctly for you. Um, and if you've not had a benefits meeting with a retirement specialist, please consider having one, especially if STEPS is something you're considering so we can get, we can more personalize this to you and what the insurance would cost you based on your date of hire and your years of service.
Okay, well, that is all that we have to share with you today. Let's see here. All right, okay, I think that was the Medicare question. Thank you. Many thanks to everyone who did take out time once again to attend this presentation about steps today. And once again, and although it's been mentioned in the chat, this is being recorded. I know a lot of you were trying to get this in, whether you had a 30-minute lunch or an hour lunch. And so we want to be sure that you're able to, no apologies for the questions. That's what we're here for. And if someone apologized for the questions, that is what we're here for. So thank you all. Thank you all for hanging in there with us. And once again, my name's Nicole Waite here in HR Temporary Employment. Kirsten McKinney, our consultant. Thank you for helping today. Thank you, Terry, for helping with the presentation. And thank you all for attending and have a great rest of your day. All right, bye.